My name is Olivia Beck. I'm a graduate nurse practitioner student here at Auburn University, and I'm going to be doing my head-to-toe assessment on Molly. All right, so Molly already came into our clinic. We got her vital signs, we got her height and her weight, and we did a visual acuity test with our Snellen chart. Everything was in normal limits, and her acuity came back at 20/20, so perfect. All right, so I'm going to come in, kind of do a quick little overview of Molly. I can see that she doesn't appear to be in any distress right now. She looks well-nourished, well-groomed, adequate looks for her age, so nothing that kind of strikes you off guard in the beginning. I'm going to come in and kind of just take a look at your head, your scalp. I'm checking for any lesions, any lacerations, or anything like that. And I'm going to take a quick feel. Let me know if you have any tenderness.
No tenderness.
Perfect. I'm going to take a quick feel of your sinuses. Let me know if anything hurts.
No.
Perfect. All right, I'm going to take a quick feel of your ears. Any tenderness with that?
No.
Wonderful. I'm going to go ahead and kind of go through the cranial nerves. So the first one, we're going to do your nose. If you can, Molly, just close your eyes for me. And let me know what you smell.
Permanent marker.
Perfect. And Molly, I'm going to close one of your nose. If you can, just take a sniff in. And again. Wonderful. I'm going to take a quick look inside of Molly's nostrils. Wonderful. Turbinates are nice and pink and moist. And while I have this, I'm going to go ahead and take a look inside your mouth. If you can't open wide, take your tongue out. Perfect. Lift that tongue up. Beautiful. Buccal mucosa is nice and moist and pink as well. Take a quick look in your ear. Perfect. Tympanic membranes are both there and gray. So we tested cranial nerve 1 with your olfactory. Cranial nerve 2, Molly, if you can't cover your right eye for me. And then just let me know how many fingers I'm holding up.
2, 1, 3.
Wonderful. We're going to switch over to your left eye if you can.
2, 3, 1.
Perfect. And I'm going to check your perla for cranial nerve 3. Perfect. Her pupils are nice and round, both reactive to light. Cranial nerve 3, so cranial nerve 3, 4, and 6. Molly, if you can, follow my finger with your eyes without moving your head. Perfect. So cranial nerve 5, I'm going to take a quick feel on your face. If you can, close your eyes for me and let me know if what you feel is sharp or soft.
Soft. No, sharp.
Sorry.
Soft. Sharp.
Perfect. So cranial nerve 7, if you can, raise your eyebrows. Perfect. Squirm down, pull out your cheeks, and show me your teeth. Wonderful. Everything looks nice and symmetrical. Cranial nerve 8, we are going to take a quick listen to your ear. If you can, I'm going to start with the whisper test. I'm going to say a couple words behind you. Just repeat them back to me.
Obvi rules. War Eagle.
Perfect. And then next, we are going to do the Rhines test. So I am going to put this on your mastoid process first. Let me know when you stop hearing it, and then I will put it close to your ear and let me know again when you stop hearing it.
Okay. Stop hearing it. Stop hearing it.
Perfect. And I'm going to do one last, so just let me know if you hear it in one ear or both. Perfect. Okay, and then we're going to move on to cranial nerve 9. 9 and 10. So if you can, open that mouth wide and take that tongue out. And I can see the uvula. And then for this, I would check Molly's gag reflex, but we're going to be nice and not do that right now. Cranial nerve 11. Go ahead and shrug for me. Perfect. And then cranial nerve 12. If you can, just repeat back what I say to you. Grad school is awesome.
Grad school is awesome.
Wonderful. Molly, so we're going to move on to your neck. I can see that Molly doesn't have any tracheal deviations, nice and midline. There's no masses, no bulging or rashes or anything like that. I'm going to go ahead and palpate. Let me know if you have any tenderness.
No.
Wonderful. I'm going to go ahead and palpate while I'm down here for your lymph nodes. And none are palpated. Any tenderness with that?
Yeah.
Wonderful. I'm going to come around, take a quick feel of your thyroid if you can swallow. Wonderful. Go ahead and put your head up to the sky and chin to chest. If you can, turn to the left and then to the right. And then left ear to left shoulder and right ear to right shoulder. Any tenderness with that?
No.
Wonderful. Great movement. All of Molly's neck range of motion is normal and intact. Then next we are going to move down to your respiratory. I'm going to come and take a look at your back. Okay. For this, I would have Molly have her shirt off with the gown open in the back, and I would look at her skin to see if I see any masses, any abnormalities, or anything like that. And everything looks great. I'm going to go ahead and take a feel. Do you have any tenderness or anything?
No.
Wonderful. We're going to go ahead and do some tactile primitives. If you can, just say 99.
99.
Again.
99.
And one more.
99.
Perfect. Would you go ahead and check for CVA tenderness? Let me know if you have any pain.
No.
No. Perfect. We're going to come down to Molly's 10th rib. So I'm going to put my hands around her rib cage and ask her to take a big breath in and out. Wonderful. And they're nice and symmetrical. Next, we're going to do some percussions. And I'm going to ask Molly to take a big breath in and hold it. And let it out and hold. Perfect. So with that, I was testing Molly's diaphragmatic excursion as well as any dullness or anything, and it was nice and sympathetic. So next, I'm going to take a quick listen. Let's continue to take a big breath. Perfect. Okay, I'm going to take a quick listen to the front. Wonderful. And then I'm going to take a quick listen to Molly's heart while I'm up here, so Molly can breathe regularly. You're going to listen to the aortic, pulmonic, second pulmonic, come underneath to the tricuspid, and then to her mitral. And then we are going to switch it around and do the same with the valve. Mitral, tricuspid, second pulmonic, pulmonic, and aortic. Perfect. So I'm going to ask Molly to go ahead and lay on back. You're going to lift the legs up. Okay. And then I'm going to listen again to her heart. Perfect. And then no murmurs are heard. So next we are going to take a quick look at Molly's belly. And at first you can see that there's no masses, there's contours nice and regular. There's no discoloration, no rashes or anything like that. So next I'm just going to take a quick listen to it. And vowel sounds are heard in all 4 quadrants. So next I'm going to take a quick listen to the aortic artery, her renal arteries, iliac, and then to her femoral. And then next we're going to do a little percussion. We're going to percuss for the liver. And then we're going to do some light palpation. I don't know if you have any tenderness. We're going to go a little bit deeper this time.
Tenderness.
While we're here, we're going to go ahead and palpate for the kidneys. And then see if we're able to palpate the liver or the spleen, as well as the aortic. Perfect. And then while Molly is laying down, we are going to go ahead and start down with her legs, so we can see that her legs are both regular, that there's no differences, they're both symmetrical. Molly, I'm going to go ahead and test your senses. If you can, close your eyes and let me know if you have any, or if you feel sharp or soft.
Sharp. Soft. Soft. Soft.
Sorry.
Sharp.
Sure. And while you have your eyes closed, we're going to go ahead and test on your arms as well.
Okay. Soft. Sharp. Soft. Sharp.
Perfect. Did you have any differences in either arms or legs?
No.
Perfect. So then we're going to go ahead and palpate the knees. Any tenderness?
No.
Wonderful. And palpate the ankles. Any tenderness?
No.
Okay. And I can see that Molly has no edema or anything. We're going to feel for her dorsalis pedis. Check her cap refill. Posterior tibial. Popliteal. And her femoral. Wonderful. So Molly, if you can, bring both legs over each other. Wonderful. And then out apart. Wonderful. And you can relax them on down. If you can, bring your right knee up into a bend. Wonderful. And then do the left as well. Perfect. And you can extend them both. Bring your toes up to your base and point them outside, inside. Wonderful. We're going to go ahead and have you sit up just a moment. Relax those knees. And then I'm going to ask you to push me away and then pull me close. Wonderful. We are going to go ahead and test Molly's reflexes. Sorry. Then with the Achilles reflex. It's okay. And then we are going to go ahead and test for the brachial reflexes. So I'm going to ask you to try to relax as much as possible.
Okay.
And for her brachial radial, try to relax as much as possible. And for her radial. And then on the other arm. So then I'm actually going to ask you to stick your arms straight out, up with your head, back down by your side, out in front, and then coordinate, wiggle those fingers, and then take your wrist out, inward, down, and up. Wonderful. I'm going to go ahead and take a quick look at Molly's shoulders, make sure any tenderness, any down with this. Okay. I'm going to assess for some radial pulses, some brachial pulses. And then we're going to go ahead and assess for a carotid pulse. I think you missed it earlier. I'm going to go ahead and take a listen to her carotid pulse as well. And then we are also going to go back and take a look inside of your eyes. I did forget to do that earlier. You can just look straight ahead for me. And I can see Molly's optical disc and her conjunctiva of her eye is normal color. So next, Molly, we're actually going to have you stand up for me.
Okay.
I'm going to take a quick look at your back.
Okay.
And let's see. Any tenderness or anything?
No.
Wonderful. If you can, go ahead and bend over and touch your toes. And at this time, we're going to check and make sure that she doesn't have a bend in her spine or anything like that. It looks great. Come on back up, and then go ahead and lean back a little bit. Wonderful. Then the side, and the side. Perfect. And then bring those feet close together. And close your eyes for me. And there's no swaying noted. Perfect. You can open your eyes. Go ahead and walk towards that trash can away from me.
Okay.
And I'm just assessing your gait. Perfect. And then when you walk back, step on your tippy toes. And then you can stop and do heel to toe walk for me. Perfect. Alrighty, I think that kind of sums up my head to toe assessment.